Hello, everyone. Welcome back into My Chamber TV, the heartbeat of our community. I'm your host, Barbara Marville Kelly. Thank you so much for joining us. I also have a co-host, as usual, the first Wednesday of every month, Mr. Paul Friedlander from the West Pasco Chamber of Commerce. And I swear you've custom designed this for my own personal interest. I know this
I'll
for
tell you
sure.
what, we've got a lot of great members, but are the shows not getting better and better?
The shows are getting so, yes, of course they are. And without further ado, I want to introduce Dr. Lisa Maharajh. And you are a acupuncture physician and have been for quite a while in the area.
Yes, Doctor of Oriental Medicine, so Chinese medicine, herbs, acupuncture. We also do functional medicine now at the office. So as my training has evolved, we do a lot with functional medicine, which is hormones, thyroid therapies, natural.
Nice.
We have an herb shop.
I heard about that.
Yes, that's new since we moved. We moved about a year ago to the downtown Newport Richey area, and it has been just the best move. It's been really good for the office. We've been able to expand. So the herb shop, it's more of an herbal pharmacy because we use herbs like medicine.
Yes.
So sometimes you don't have to take things for a long period of time. It's just because you have a cold or you have an upper respiratory infection. You take herbs for that time period and then you can stop taking them. So we use them as medicine.
And I'm very familiar with that I have been an acupuncturist patient for I can't tell you when. I believe so much in that, and this was way before I ever knew you. You're right around the corner.
Yes.
Now, yeah. So this is really fabulous. What can you share about acupuncture to take the fear out of needles? Can you? Do you have something?
Absolutely.
Good.
So think of a needle, it's the size of a piece of hair. If you literally look at a piece of your own hair, that is the diameter of an acupuncture needle. Also, 15 to 20 acupuncture needles fit in the tip of a hypodermic needle that they draw blood with. So 15 to 20 needles fit inside the tip of that. That's how tiny they are.
That is a really good description because that would take the fear away from me. I'm old hat at it now because I know the results that I get. The concept, can you explain the concept of acupuncture and where it goes, and why it can be an alternative for you?
Absolutely. So if we think of the body having a network of rivers and streams that run through it, that is what our pathways or meridians look like in Chinese medicine. So the idea is to keep the circulation flowing through the body, to keep the rivers and streams moving through the body, and to not have any dams built in the rivers, no blockages in the body. That's kind of the basics. Of course, there's more to it. But if you can just think of flowing rivers, that's what we want running through the body. And the needles, actually, when inserted into the acupuncture points, they help move that energy. There are points that do specific jobs. There's points for digestive issues, different points for sleep issues, stress reduction. So there are many ways that we can use to heal and treat the body, or let's just say allow the body to heal itself, because that's what it's doing.
That is. You're setting the body
That's
up
right.
so that the body has all the wonderful tools to do it on its own.
We're giving it what it needs, and that is the premise of natural medicine as a whole. If you give the body what it needs, it is believed that it can heal itself. I believe that.
Oh, I believe that too, and I have done that. I have tried a lot of the traditional medicine, not that I wouldn't go back to it. It depends on what the situation is, but I know when I I injured my rotator cuff many years ago, and it was very hard for me to demonstrate on the Home Shopping Network. For 3 months, I was in chronic pain for 24/7. And I found, do you know Eva down in Palm Harbor? Eva Chang?
That sounds familiar.
This was years ago. And I went in, I was scared to death because of needles. I don't like needles, but I just did my deep breathing and she got me through it. And honestly, she opened up those chi channels, and within a very short amount of time, I could move. I almost had a frozen shoulder.
Wow.
And that was really tough. Now, do you also do any EFT with what you're doing, the emotional frequency therapy?
We do a little bit of that.
Do you?
We do a little bit of that. We're more of a medical office, more of a medical practice. So we leave that to some places we may refer to because we like to work with the community. So, you know, it's nice to have those referral sources.
Absolutely.
But yeah, there's a lot to be said about natural medicine. It really is.
Yeah. Well, you know, I love the idea that what you're doing with the herbs and everything, and you're coming from that more medical standpoint and everything. Have you had any acupuncture, my friend Paul?
I have not. My mother has, and
Yeah?
her 91-year-old boyfriend has, and I have not. I haven't gotten to that point. Not that it would be anything. In fact, I was going to ask you a question because it seems like it's becoming more and more prevalent. But and I hope this doesn't sound wrong, but I would think that a lot of times it becomes the last resort where it would be really nice. It actually should be first resort. And what are you guys? Is there something you guys do to reverse that trend? And again, I hope I'm not offending you, but
No, I joke with my husband David, who's our herbalist at the office. How can we intercept sooner? How can we let people know we're here
Yes.
before they come to us with the diagnosis?
Exactly.
Or, we're trying to
Yes.
get that preventative medicine.
Prevention.
Yes,
Yeah,
exactly.
absolutely.
Well, this is a start. Right here on My Chamber TV, you're right here in the community. And I will say from my own experience, don't be shy.
Yes.
Give their office a call because you just never know when there may be an alternative that could help you in prevention and opening up those chi channels. Do you find that stress is very contributory to the different areas that we get tightened up and all that?
I'll tell you, more of the recent research that's coming out is saying that 80 to 85% of all medical office visits, common cold, heart issues, are stress related. 100%. And if you look at the stress of children, of working, of taking care of, just not clearing our, not saying no, not being able to say no to people.
Yes.
It gets stressful for the body. And here's the common thing I hear. I don't feel stressed. I feel fine. But your body tells me a different story. And those are things we look at in consultation so that I can let them know what I'm seeing compared to what they're telling me. So it's very important. And I agree with the Western medical system. They have their place.
Sure, absolutely.
Emergency medicine, trauma medicine,
Yes,
absolutely.
yes.
So we are more preventative. However, we deal with thyroid disease very frequently. So
Do you?
there are things that we can do to really help heal the body versus just maintain and bandage everything.
Right. Putting the Band-Aid on just makes it worse and worse and worse. Do you work successfully with allergies and things
Yes.
like that
Yep.
to help with that?
There are a lot of things we do in the ear that help with allergies. There are root causes for allergy issues, including
causes,
food
there you go.
allergies and environmental allergies. We look at different areas of the body so that not only are they less, but ultimately we'd like to see you not have them at all.
Exactly.
So that's the goal, is to really, because that's not normal.
Right.
You know, it's not normal for the body to react in this way of allergies. It's common. A lot of people have it, but that does not make it normal. So we take that one step further and say, yeah, it does happen, but it doesn't have to happen.
Exactly. Do you find emotions are connected to a lot of this?
Yes. Yes.
I tell you, and this is something, believe it or not, that I still remember, but 8th grade health class, which was, for all you know, about 10 years ago, but 8th grade health class, back then, the number in the book was 75% of the people had self-induced illnesses. That was
believe that.
40 plus years ago, and that was in that.
Yep.
And that's the one thing I always remember from that health book. 75% of the people had self-induced illnesses.
It's nice to be able to come to a place where we can guide you.
Yes.
If I'm not teaching somebody why their body's acting the way it's acting and then showing them how to heal that, I'm not doing my job.
Right.
At our office, we really teach and empower
Yes.
people, because you can go to the health food store or online and pick things up, and that might work for a little while. But it's nice to have somebody that can say, this is the new research, this is what we're finding, this is what helps. Everybody is different.
Right.
You know, everybody,
right.
two people can go into the store with the same symptoms, but at our office you get two different formulations.
Right.
Yes.
Right. It's not
Different-
cookie. It's not cookie cutter.
No.
It's not cookie
And
cutter.
that's the key, is
Yeah.
finding what's right for you, because what's right for you might not be right for Paul, even though you both have the same thing.
Interesting that you're saying that education, because my gal that I had been going to a couple of years ago, she actually taught me how to help myself with a boost in my high blood pressure by taking the little they call lancets in the top of the ear and pinching the ear. I thought I was going to throw up the first time I did that, but you know what? the darn thing
It
worked
works.
for me.
It works.
Now, and we're not making any claims or cures or anything like that. We got to do that disclaimer and everything. But for me, I wish there was somebody filming this because I was white as a ghost, but I did it anyway because I thought, well, it makes sense if I'm going to release that pressure. And sure enough, that
Like
blood
a pressure cooker.
Yeah,
It's like a pressure
like a
cooker.
pressure cooker.
The body is phenomenal, simple yet complex.
Yeah.
So
Well, you've been doing
it's
this for a
fun.
good little while.
8 years.
8
8 years on
years.
my own.
Yes.
So-
That's so fabulous. And you have a new doctor, Dr. Stephanie, because we're
Dr.
getting ready to go to a
Dr.
break. I don't want to
Stephanie Jones.
miss out on Dr. Stephanie Jones.
Dr. Stephanie Jones joined us a couple weeks ago. She has been an amazing asset.
Great.
She was a Paul Send, if I will.
Awesome. I love it.
It's tough to grow. It's tough to grow, especially because it's our family business. So it's tough to put trust into other people's hands, and that was
yeah.
something we were struggling with as a business. Thankfully, as we moved down here and joined the chamber, we are forced to grow, and I love that because our goal is to help more people. It really is.
Oh, absolutely.
So Stephanie was brought on board. She has done an amazing job. I joke because she's like me 10 years ago.
Oh, isn't that's what got to
Well,
make you feel
what's-
really
yeah.
wonderful, pulling her under your wings like that.
Yeah, yeah.
Oh, that's
She's-
fabulous.
yeah, very
So
talented.
is she a doctor of Oriental medicine as well?
Yes.
Well, we'll have to get Dr. Stephanie on here too.
We'll do that. I'll
at
tell
some
you who we
point.
need to get on here. We got Smiley hanging out in the back because he wouldn't come on today. But when you get in there, not only are these lovely ladies, both Dr. Lisa and Stephanie, wonderful to deal with, but you will walk out feeling so much better when you have a chance to talk to the man that also does the herbology side of things, and that's Dr. Lisa's husband, David. David is, he's constantly has a smile on his face. He constantly makes you feel better, and he wanted to give the spotlight to Lisa today. But we
that's
tried
so
to talk to him,
cute.
but just again, they've been wonderful members in our community. We're so
That's
excited.
so great. Well, we're
so
delighted,
excited.
Thank you.
delighted to have you on the show. We'll definitely have you back. Come back with Dr. Stephanie, and we'll talk more about acupuncture. And don't be afraid of it. Give her office a call. You never know what she might be able to do for you. But thank you, my dear. You're
Thank
a
you.
delight.
Thank you.
And it's
Thank
good to
you.
see you
Thanks
again
for
in
coming
town.
on, sweetie.
And we'll be right back after this. We have more guests right here on West Pasco My Chamber TV.